Hello everybody, my name is Farai and I'm a physiotherapy student studying at Vincent Paul University in Poland. So right now I'm documenting my journey for you guys and also the future employers. So not to waste time, today our patient is a 30-year-old female who works as a dishwasher at a restaurant. So most of the time she spends facing downwards washing the dishes. So she came complaining with neck pain and also some pain in the feet. So upon examination, the postural abnormalities that I saw was that she had a forward neck and a C7 hump, which is caused by the line of work that she is in. And to take it a bit further, the problems that I saw was she had sharp pain between the rhomboids during head flexion and limited lateral neck flexion and rotation, suggesting the tightness of trapezius. I saw tight bands of scalenes, meaning they were really tight, and during rotation and lateral flexion they would emerge from the skin. Now moving on to the neurological symptoms, she said that she sometimes has numbness running down the leg and also the hands. And in the hands, this numbness is sometimes accompanied by loss of strength, which led her to break a lot of kitchenware. The legs also have a burning sensation during the night, and I asked her to screen for diabetic neuropathy, and she said she went and did the test, but there was nothing which was indicative of diabetes. So we had to rule out diabetes for that. Upon further examination, she told me that she was once diagnosed with venous insufficiency, which is also a causative factor of this paresthesia and numbness in the legs, and she was given a compression stocking to wear, but she rarely used it. And during the testing of the nerves of the upper limb, I saw that she had a hypersensitive median and an ulnar nerve, but the radial nerve was okay. Unfortunately, the first session I didn't get to record it, but I'm just going to tell you the list of therapies that I did in the first session. So to treat the nerve irritation or the hypersensitivity in the nerves, I gave her a nerve flossing exercise. So she would floss the medial nerve in this kind of way. So as she would extend the hand, extend the wrist, and lateral flex to the other side. As she is laterally flexing to the other side, she was to flex the wrist. And when she would come back and flex to the other side, she is to extend the wrist. This creates a flossing motion in the nerves. And for the pain in the trapezius, what I did was some deep tissue massage, putting more emphasis on the upper trapezius since they are the ones that are mostly stretched in the working position that she's always in. And I also did some scraping and some vacuum cupping. And for the exercise to fix the stiffness and pain in the trapezius, I gave her some neck retractions. I told her to lie on the bed and dangle the head and then retract the neck as far back as possible. So during the retraction, I told her to tuck in her chin first and then retract, not just throw the head back, but tuck in the chin and retract. I only managed to take these few pictures at the end of the session. The next session that we did was a week later, and she told me that the exercises were helping very much and she didn't feel any pain or stiffness in the trapezius. But unfortunately, her legs were still painful. So upon examination, we saw that the legs were fluffy, which was suggestive of edema buildup. Then we did the pitting test and she barely had a grade 1. So the fluffiness of the skin was because of the adipose tissue and a little bit of fluid retention. And upon palpation, I saw that there were lumps of adipofascial adhesions, which were painful. And to treat this, what I did was deep tissue massage. And to combat the fluid buildup, I did lymphatic massage. So I did deep tissue massage in combination with lymphatic massage. And to finish off the session, what I did was some scraping to break the adipofascial adhesions that I felt during deep tissue massage. Then I removed the oil to put some kinesio tape in a pattern that would allow for passive fluid drainage, which is lymphatic kinesio taping in short. The third session was 3 days later, and the legs were feeling better, but still she felt some pain at night. She had worked 10 hours the day before, so she was feeling pain in the trapezius from the static working position. And upon examination, she had pain in neck extension, which radiated to both sides of the trapezius, and in head flexion, she had tightness in the lower fibers of the trapezius. To treat this, I did some deep tissue massage on the lower fibers of the trapezius. They were tender that when starting the massage, on the pain scale, she had an 8, and after the massage, the pain dropped down to a 2. And the upper trapezius had many trigger points as usual, but the tension was less compared to last time, showing improvement. I also found tender spots on the supraspinatus, and I did some deep tissue rubbing to relieve this pain. She also said that when reaching for things overhead at work, she felt some pain in the back of the shoulder, so I massaged the posterior deltoid to relieve this pain and tension. On the pain scale, it was an 8 at first, and then we ended the session at a 2. Moving on to the lower extremities, we did the regular pitting test, and there were better results compared to last time. But the adipofascial adhesions were still present, so to break them, I did some deep tissue massage in combination with lymphatic drainage massage to remove the fluid buildup in the legs. For deep tissue massage, I used the rubbing technique, and for lymphatic drainage massage, I used the pump and push technique. And to wrap up the session, I did some lymphatic kinesiotaping to provide passive lymph movement to reduce edema buildup. On the fourth appointment, she was now feeling better. She was now moving most of the time without feeling any pain in the trapezius. But unfortunately, she had a flare-up of plantar fasciitis during the week when she was working. On the right leg, she had some swelling on the ankle, but it disappeared the day after. When now testing the neck, I saw that a few movements provoked the pain. These movements were neck extension, lateral flexion, and cervical rotation, mostly to the right side. And due to past observed thoracic stiffness, I had to do a functional movement, which is touching the toes, to assess the flexion of the thoracic spine. And it was more or less okay. So before the treatment, I palpated and found some tender spots along the left side of the trapezius, which is the most problematic in lateral flexion. So the therapy, I did deep tissue massage on the tender spots of the trapezius and also both sides of the upper trapezius. And to conclude the session, I did vacuum cupping, leaving the cups on for about 5 minutes. Moving on to the lower legs, I did the pitting test as usual, and then she had significantly better results, so this was a big improvement. So for therapy, I did the same as last time, deep tissue massage in combination with lymphatic massage. During deep tissue massage, focusing mostly on areas where I felt adipofascial adhesions and strands of tension. And during lymphatic massage, it was the usual pushing from the feet up to the knee. And while checking the last problem of the day, I saw there was no irritation of the plantar fascia. The passive windlass test was negative, so I just did deep tissue massage, focusing mostly on the medial arch of the foot. During our fifth session, she was feeling pain in the left leg and she was feeling that it was weak compared to the other one. But on the bright side, there was no longer any pain in the trapezius in doing all the movements of the neck, just a slight stretch during lateral flexion. And I did the pitting test and the results were worse compared to last time. And then she told me that she has been forgetting to elevate the legs after work, so maybe that's why. So for treatment, what I did is the usual deep tissue massage, focusing mostly on areas where I felt adipofascial adhesion. And then after, I did lymphatic drainage massage, pushing the lymph from the ankle towards the knee. And then for exercises, we did calf raises and assisted lunges to build strength in the lower extremities. So this is a general overview of how I will be treating the patient that I come across day to day. And it's not just a one-man effort. The patient also has to put in the effort to do the exercises that I prescribe at home. Now here is a testimony from the patient. This is the fifth session that we just had. How was it? How has been the journey from the first session to now? Have the symptoms improved or is just the same?
Firstly, I would like to appreciate you because what I was feeling from the day one we started the session is totally different from now. I'm feeling a great change. It's just like a miracle. The way I'm recovering, though I'm still facing some challenges with my legs, but it's a great change.
It's a great improvement.
Yeah, great improvement.
All right. And on a scale of 1 to 10, how would you rate the sessions?
Well, I'll give you a 10.
That's lovely.
Yeah.
That's lovely. Yeah. And would you recommend these sessions to another person?
Definitely, I would do that. And I will refer with a 10.
A 10 as well?
Yeah, a 10 as well. I think I have referred a couple of my friends. They're coming again. They're testifying. Yeah, so you're doing a great job.
All right, thank you very much. If you made it this far in the video, I want to thank you. Please like, comment, and subscribe. I would really appreciate it. See you in the next video. Bye.